All right. Good morning, everybody. We are here for our weekly Marion County Board of Commissioners meeting. It is Wednesday, July 7th already. Wait a minute. Wow. Already it's July 7th. We're here in the Senator Hearing Room at 555 Court Street, Northeast. And as always, we would like to start with a Pledge of Allegiance, so if you'll join us. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. It's amazing when you're so busy how time flies. Wow. All right. So, our none is here for public comment today. Noni, right? Nobody signed up. Our first thing on the agenda is a presentation by Scott McClure for a wildfire recovery update. Let's hear all the good news, Scott, and the challenges.
Okay, well, thank you. Scott McClure, long-term disaster recovery manager, and doing a PowerPoint. You actually have a copy on your desk, or screens are fine, whichever is your preference. First thing in 10 months, we've been in this business, and as I've emphasized before, Marion County never really stopped. It didn't stop at, oh, we're done, December, Christmas, you're all done with activities, so very much keeps going. Next numbers I wanted to note, we're basically onto the building permits, and we're working to get similar numbers from Lynn County. We got to the right people now, so we're going to be able to integrate those in hopefully by the next meeting. Uh-oh.
I think you're going backwards
Maybe
on
not.
the toggle.
Did I hit something?
If you're letting HP take over, watch out. There may be some dancing monkeys that come across the screen.
Yeah, I've been
Be
told.
careful.
So, yeah. Okay, so we'll go there. So building permits as we go. So we got Gates for the month ran 31, Detroit 46, and then unincorporated 112. So the interesting one there is that Gates actually, because they had a functioning water system, was working a little bit better with permits. Detroit's picking up now, and unincorporated. It's definitely been able to pick things up. And then on the septic side, kind of similar trends, Gates 42, Detroit 81, unincorporated 140 for 263. On the dwelling permits, we're tracking about 27% and about 38% on septic, which is logical because some folks do their septic first, get that going, and then move on to the other permits. Recovery projects, these are all grant-funded projects, a variety of items we're doing. Financial needs, Gates and Detroit needed help reconstructing their books, trying to do some projections moving forward once all your variables changed essentially on your budget, particularly the water systems. That work's going well. We hired a communications and outreach firm. Idea there is you had a lot of information out in the world, different groups. We're going to try to consolidate all that information, get to a central point. The firm's working on a communications plan, and then also working on how to get that kind of main Santiam recovery org. If people have seen that website, we're going to try to update that and then make that more of a centralized place that everybody can feed information into. Economic impact opportunities analysis, that's what do you do when you fundamentally destroy an economy? There was pre-state economy, and then there's what's now, and then kind of how do you accelerate the recovery? Some part of the recovery will be natural, but some we want to accelerate. So we have the firm selected there, contracts in their hands. We should have that executed pretty shortly. Health impact assessment, that's looking at sometimes physical effects, just the debris, hazardous materials were up in the area, and the big side's mental health. They're going to be, actually OSU is looking at that, and they're going to set up next week. And what they're going to be looking at is what other disasters happen, do kind of a data kind of backwards on other systems, look specifically at our experience, and then come up with basically some plans. Some will be tips for the next time we have an incident, but then also what kind of care do our residents need, for the next couple of years? Like when the anniversary comes up, do we need something different? Are there check-in points that we can help out in different areas?
What does it mean when you say they're going to set up? Are they going to be up the canyon interacting with people? Is this a remote process?
Most of their process is going to be remote. Yeah, they're going to be working on, data searches, looking at other disasters. We're going to have them in contact with like SIT, so they can get on the ground, where people were. One thing here is a sensitivity to continuing to ask people things and relive. So we're trying to limit that for the most possible. They've got it in there potentially. They might do some some on-sites if they get some volunteers, we'll be willing to help, but they're going to assess that when they get more toward the tail end of the project.
So overall, we're gonna try to collect this information through like a telephone system? Because it sounds, I understand the trauma impact and not wanting to constantly relive it, but I have concerns about the information not being properly or currently relayed, because with SIT, several thousand people were engaged in the very beginning in the first few months, and then they haven't interacted with them since. They don't go and reopen those cases and have that ongoing dialogue. So how does that get captured? How does that first percentage of people get assessed?
Well, they're not going to be directly assessed. We're actually trying to avoid directly assessing people. So they're doing their research based on what other research has been done. The state's done some really good analysis. We're going to be using the SIT team members to basically give the researchers their feel for what the impacts have been, what they saw, and then if we think we need to, at the tail end, they might do some direct contact with individuals, but it'll be very limited.
Yeah, okay, so that's my point, I guess, is I'm not asking you to necessarily engage. I'm letting you know that I have a concern with the fact that we're not engaging the large percentage of people who have not been engaged by SIT for months. There was over 1,000 families that came through the process in the very beginning and spent the first few months in recovery with them, but then have moved forward. How is their trauma assessed at this current point if we don't engage them? Because SIT would no longer have that information.
Yeah, I think we are relying on SIT, and I've talked to them about the process, that just, we're looking for more anecdotal, kind of more consolidated information. Yeah, we're not doing an assessment of hundreds of people, thousands of people, and trying to get to an exact what their experience was. It's more of a high-level look at a study, so we aren't getting to that level of detail.
Okay.
This is more of a sample.
Yes, yeah,
Like a
using
normal sample
kind of
survey.
building on other research, building on what state's done. They've done some really good studies that we're going to be, we're drawing on those. Working with the people that were in the field to get their assessment, and then we'll kind of see if we need to really reach out to folks at the end just to top things off.
Okay.
Then the community visioning and strategic plans, those will be separate processes. So one company, but we'll do one for Gates, one for Detroit. And the nice thing there is that will be an overall vision, but then down to specific plans, specific things that they can do to improve their communities. That firm's almost ready to go. They've already been making contacts even while we've been working on contracts. And then legislative advocacy, wanted to go through, really focus on legislative funding. There was a whole bunch of other activities regarding property taxes, exemptions, waivers, but just on the funding side, very big note that Marion County is very active, very aggressive between the commissioners and the staff, did a really good job presenting cases. I think was seen as a leader in the community looking at all the wildfire impacted counties. So our big ones went through the system is $50 million for a sewer and septic system. So that's for up in the canyon. That would be a kind of a main system that would be kind of tied in with Mill City and Gates. And then another one focused on septic for Detroit and Idana. So we have that funding going through. Water system for Detroit. Big one with Detroit is what they had there. If you went back to what it was, it wouldn't work. It just, all the systems, the dynamics are changed. And so they're looking at that with working with FEMA and also with the state legislative funding to get basically a new system that will be operational into the future. Gates water meters, we had $25,000 for that, just for the ones that got burned in the fire. Detroit Idana Fire Station, $2.4 million. Lions Detroit Summer EMS, it's actually stationing some EMS services up in the Detroit area with all the tourism. And so we actually had $300,000 for that. Gates Main Street improvements, which will be nice because we're guessing that'll come out of their visioning project. That'll be $600,000. And then basically for both counties, I consolidated these numbers. Fee waivers from building permits, $787,860. And then we did Drake Share Fire Department. They got a $5,000 reimbursement. And then helping out with the building and staffing needs from all the extra building permits. It's $1.25 million on that. And then operational needs for Gates and Detroit, which is critical because those towns probably would have went under financially. Got $772,000 there. That'll keep them going at least for a few years while their towns rebuild and revenues start coming back in. Anything there?
Scott, did you already report on how much we've waived on building and planning permits yet? Are you going to? Do you have that in your notes today?
I didn't have that exact number.
We just got it yesterday from Brandon. Was it 300 and?
It's a little over
Oh, let me see.
300,000.
It's over 300,000 we've already waived in Marion County on
It's
building.
on the
and-
right side of that spreadsheet you're looking at.
Okay, so the building permits, yeah, we had $231,000, and then septic was $127,000, yeah, so
Yeah,
$358,000.
$350,000 we've already
$358,000,
waived.
yeah.
And, you know, Jan, maybe clarify, the building and planning department staffing, I got that email from AOC that said basically it went to Business Oregon and we have to go get it there. Is that your understanding?
Correct.
Yeah, okay, good. So, but we're saying it's coming in some way. It's not coming
Right.
direct to us.
Yeah.
Or
And-
Lynn
It's a
County.
reimbursement.
Yeah,
Yeah,
Yeah.
and some of those are more direct, you know, the ones that were interesting that I think a couple ones we'd hoped for funding, you know, not every county got everything they wanted. We had a radio tower that was very critical up there, did not get funding, and then a
Right.
fair amount of the housing money is gonna get dropped into some new program, which they're developing right now, so in the future, we'll be jumping into those grant processes.
thanks.
Then just some other items. We're doing an after-action report, and that's as it sounds. It's, you had a fire, you had a disaster, and then somebody comes in and says, how'd you do? And then looks through spots, areas where you could improve, and this will help us go forward into the future. We're going to have an open house on that, which will be July 22nd at Santiam High School. And I think the idea that anybody of interest will be getting that out to, make sure that folks are interested. Figure some people would be, so. We'll go there. Just to reach out to make sure that other partners are involved. I met with the Lions city manager and just kind of gave an overall update on our recovery efforts, and particularly like the economic impact study, trying to consolidate the public information. I had a good meeting there. A couple other notes on water usage. They said that during the week, the system's working fine. On the weekend, pushing limits a little bit. It's kind of pushing, but it's within. It's okay right now, nothing failed, but it's definitely kind of taxed the system a little bit on weekends.
Thank you. Detroit?
Yeah,
Well, if we made it through this weekend,
Yeah.
we're
Yeah.
probably pretty good.
yeah.
I got up in the morning, took a shower, and it worked.
Thank God. Oh, well.
And then just one note, if I could defer to Commissioner Bethel, talk about housing efforts,
You want me to talk about housing efforts?
if you could.
Yeah,
If you'd be
before I
okay with
do that, well, have you had a chance to connect with the IDEANA mayor? It might be a really good idea if we fold them into some of our communication and conversations. I know they weren't overly impacted, but they were somewhat.
Yeah.
And this weekend I saw them mulling around in Detroit, so if you could
Yeah.
do that, that'd be great.
Yep.
So for housing efforts, oh my gosh, we have a lot going on up there. We have a survey out to the community of the canyon who are impacted, asking them what their before status looked like and what their current status looks like, and really overall trying to collect what their need is. We're identifying that there's a fair amount of people living on their own land in RVs, but they were uninsured, so they cannot rebuild their homes. They have no money to do that. FEMA gave folks about $30,000, and that really goes nowhere at all. Can't even buy like a pop-up shelter for a person who's experiencing homeless for $30,000. So we, Jan and I met yesterday with Oregon Housing and Community Services in the governor's office to talk about trying to acquire a fair amount of money. $40 million is what I asked for, to be able to help people recover. And that's, we're developing a menu of housing options so people can try to live as comfortable as they were previously to the fire, but it's going to take a little bit of time. We're working with several nonprofit partners locally to try to save money, so Habitat for Humanity, Christian Aid Ministries, and a few others that provide labor, not financial resources or materials, but labor is really expensive, and if we can cover that cost for folks, that'll be helpful. And then we're also partnering people through this survey with other organizations. So let's say that they had some insurance, but it wasn't enough, and they need, anywhere between $50,000 and $70,000 to recover. Where can we save those dollars? So maybe Christian Aid Ministry comes in and builds their home, and that saves all the labor costs, so they can just pay for the materials. And then, of course, our permit department's waiving a fair amount of fees there. So it's moving ahead very slow, and my impatience and my personality is like maxed to the hill, I think, but we're
Well, let me know when you need some more. I'll give it to you.
impatience?
Yeah,
Oh,
whatever.
well, okay.
No, patience.
Oh.
Not
For a amount of my
impatience.
own. Yeah, it's been a process, but we have really great partners. United Way, Jordan Truitt, who's on their board, is a direct partner in this. Just really thankful for everybody who's showing up regularly to have these conversations. But I think the overall message here is that if you were up there and you had issues with your property, we need you to fill out the survey. And if you don't know how to do that, you can contact me here or just email the Board of Commissioners email address and we'll forward you the link. It's electronic. We have to collect the data in order to know to create a plan. So I call it, data acquisition. I'm kind of raking it in. And we've had a few hundred responses, but we know there was just about 800 structures burned on the Marion County side. So we know there's a long way to go. Speaking of the data, does the data that you presented today have Lynn County in it? Or is this just Marion County solely for the septic and sewer?
That was just Marion County.
Okay.
Yep.
So I know that you're working with
Yep.
Lynn County. At
Right.
some point, will you identify what Lynn County looks like? I don't know that everybody knows this, but Jan, in all of her eagerness, said that she would absolutely help Lynn County lead the way for recovery for them. So we're doing that with our team in partnership, and I know they're watching to kind of see what it looks like. So
Yep.
we want to keep them apprised
Yep.
of that.
Hopefully they'll be here next time, so.
Perfect.
Yep.
Thank you.
Thank you very
Okay.
much.
All right, thank you.
Jan, did you want to add anything?
No, you did a great job.
Okay,
Working hard.
thanks. I will say as a resident of the wildfire area, it was a great weekend. I didn't see any tears being shed. I saw a lot of celebration that people were coming back, and I will say, the boats are coming out early and people are disappointed in that, but here's the good thing. The lake came back somewhat and people got boats in, and we had a 4th of July, we had fireworks up there safely. There was, I think, one bad actor, but that got taken care of very quickly. Most people were very civil and congenial, and it was a really good weekend. And I had my 3 grandsons up there and my daughters and husbands, and it was a place that you would want to bring a family.
Yeah.
And it's really cool to see things coming back as fast as they are. Houses being built. I heard anecdotally this week that lumber's prices are going
That's right.
down.
Prices are
I
going
mean, I
down.
don't follow it. I'm not building anything.
41% they dropped last week.
And to see Gates, the building permits in Gates, to see the Jan, thank you for all your work. We want to thank again our delegation, our state, senators and state reps, and the wildfire committee that that Representative Clem did, and all those dollars over there, the governor, and people that worked really hard to get the money that we got. And that sewer system in Gates and Mill City will really help. We know that this is going to be a 5 to 10 year rebuild for these areas, but that'll really help them come back and with some of the visioning and planning that they want to do long term. So thank you to everybody who's watching and everybody's involved, our Public Works Department. It's really good to see the progress. It really gives us all something to look forward to as we continue to do that. We have our challenges, there's no doubt. Labor force up there, as everywhere, is a challenge, but it's even harder in the canyon for our mills that are up there, the small retail. You talk to Elaine DeGeorge or O'Donnell's trying to find people just to staff their little places when it's difficult. So we'll still meet it. And thank you, Danielle, for all the work you're doing on the housing end, and we'll get there. No tears were shed then, but almost now.
No, I know, you're doing a good job.
All right. Thanks, Scott. Commissioner, you want to move the consent calendar?
Sure, Mr. Chair, I move to approve the consent calendar under item 1, business services, approve amendment number 1 to the purchase order with Bar Green Eligson to add $5,142.62 for a new contract total of $104,235.62 to modify the standard flooring for the Marion County Jail walk-in refrigerator freezer replacement project to a more reinforced flooring that supports additional weight. Item number 2, under the Sheriff's Office, approve amendment number 3 to the incoming funds intergovernmental agreement with the Oregon State Hospital to add $150,000 for a new contract total of $2,570,000 for on-call and emergent medical transport services for Oregon State Hospital guilty except for insanity, GEI, clients provided through June 30th, 2021.
I'll second the motion. Any discussion? Oh, I was going to say, with with the restaurants I've had to close down, maybe I could have given them one of my walk-in freezers. No. All right.
It's for the floor, not the freezer.
I know.
Okay.
I know. Any further discussion?
No.
Hearing none, all those in favor signify by saying aye.
Aye.
Aye. Okay. Health and Human Services action item. Sydney is here with Alexis. Welcome. We're going to consider approval of amendment number 2 that reinstates the contract for services with Mid-Valley Rep Payee and add $30,000 to a new contract total of $125,000 to provide representative payee services to individuals receiving mental health services retroactive from May 1st, 2021 through December 31st of 2021. Welcome, good to see you.
Thank you. Good to see you all. Good morning, Commissioners. I'm Sydney Nestor. I'm the Behavioral Health Division Director for Marion County Health and Human Services.
I'm Alexis Cruz. I am the Program Supervisor for Adult Mental Health Services.
So, you already said what I'm here for. Thank you. So we're here requesting approval. Lexi can provide some information.
Yeah.
You guys are interested in what the rep payee process is?
That'd be good if you can give us some detail.
Sure. Representative payees are approved by the Social Security Administration. They are for individuals who receive Social Security funding, and the payees help prioritize, budget, and allocate and fund appropriately those resources for those individuals who have such a mental health capacity that organizational skill is challenging for them. So we utilize representative payees for our individuals who are coming out of the state hospital through our licensed care system, as well as some for their in the community. There are fees that of course the representative payee organization charges, and that's what the amount is for.
So I'm curious, do we get this funding from someplace else and it's a pass-through, or is this actually general fund dollars, or how do we accumulate the dollars that we use to pay for these services?
Sure, good question. I believe some of this is used by our choice dollars.
And some of it's connected to the IGA.
Yeah, so it's not necessarily pass-through, but it's a responsibility that we have to ensure that this service is available for certain people that we serve in this community.
Yeah, I was trying to think, as you were describing it, I was trying to think of the legal term. Of course, counsel's here, but when somebody takes over to help people manage their finances, it's like awarded to the court. What do you call it?
Conservatorship.
Conservatorship. So it's similar to that in the fact that this person is representing this person, trying to make sure that their bills are paid based on their level of income, et cetera. Okay.
But in this case, isn't your department the conservator, and then this person works for you, so you have the legal responsibility, or does the payee have the legal responsibility?
Yes.
The payee has the responsibility.
Mm-hmm.
Interesting.
They have to carry some liability insurance for that. Yep. Okay. Good. Any other questions?
No.
Interesting. This one, I've never seen this one before. I don't remember. Maybe it was on a consent calendar or
Yeah, I
something.
don't know. I'm not sure. I don't remember coming here for this for a long time, but
Yeah.
you know, last week seems like a long time. So I don't really know.
No, it went by so fast, Sydney.
You're right. It goes fast, and yet it's hard to remember. I
Yeah.
don't know. I was calling it COVID time for a long time, but I can't use that anymore, so I don't know how to describe it.
What day is it? No. Okay, good. All right.
Okay, Mr. Chair, I move to approve amendment number 2 that reinstates the contract for services with Mid-Valley Rep Payee and add $30,000 for a new contract total of $125,000 to provide representative payee services to individuals receiving mental health services retroactive from May 1, 2021 through December 31, 2021.
I'll second the motion. Any further discussion? Hearing none, all those in favor signify by saying aye.
Aye.
Aye. Thank you very much. All right, item number 2 is still under health. Health and Human Services, consider approval of amendment number 24, incoming funds intergovernmental agreement with the Oregon Health Authority to remove to remove $41,909.29 for a new contract total of $18,807,588.92 to operate and contract for public health services through June 30th, 2021. Ryan, welcome. I don't know that I've ever seen to reduce a contract come before us.
Yeah, it does happen from time to time, but I agree with you, it's rare. So my name's Ryan Matthews. I'm the administrator for the Health and Human Services Department. So I am here seeking approval of Amendment 24, which does remove $41,909.29 from our contract that expired on June 30th, 2021 with Oregon Health Authority. And this is the contract that really funds our public health services. One of the reasons it's $18.8 million, which is far and away exceeds any previous contract, is because it includes all the COVID funds that were passed through from OHA to the Health and Human Services Department. This $41,909 really is sort of some housekeeping that they're trying to do with their final contracts in terms of final payments that we will receive, basically taking away funds that we weren't going to spend. So the first adjustment, which was about $32,576, was we had submitted an invoice to the state for reimbursement for wraparound supports for individuals who needed to isolate and quarantine for COVID-19 that had COVID-19. The actual expenditures came in slightly less than what we initially had invoiced. So we amended our invoice, sent it to the state, and now that's trickling down in an amendment to remove that funding. In addition to that, there is about a little over $9,000 of PE 46 that was removed from this contract, and that is funding. We had given notice to Oregon Health Authority that we were not going to fulfill that program element of our contract. That was for reproductive health, which we no longer offer with our Health and Human Services Department. When we initially gave notice, that there was I believe a 60 or 90-day window, which meant that they left that amount of funding in our contract and then removed in a prior amendment from September 30th, I think, through the end of the year. We have since submitted financial reports. We didn't report any expenditures because we didn't have any activity in that program element from July through September, so they've gone back and removed that funding, I assume so that they can reappropriate it to other entities that they contract with to get it spent by the end of the fiscal year. So this is mostly just some housekeeping items on those two line items of our contract and not related to anything that we've spent or any funding that we were expecting to receive.
Yeah, so this removal of reproductive health was kind of a hot topic, I feel like, in the last year or so, early in the spring last year. So can you just give me an overview as to what services were provided that are no longer provided? I know that there was an audit done, and the auditor introduced information saying this isn't a utilized service of the county, and so therefore there's no sense in spending taxpayers' dollars on something that's not used, in short. But what were those services, and how is the community accessing services otherwise?
Sure. Yeah, so we did do an assessment. We had the Reed Group come in and do an assessment of our public health division, and this was not specifically aimed at this one service. It was more looking at our entire public health division and really comparing that to what capacity exists within our provider network and within the healthcare system, trying to really isolate, when we think about what county services are, they're often that safety net, so we're really trying to sort of fill those gaps that don't really exist in our healthcare system, and where there are services that can more easily and really better and more appropriately be accessed through primary care or other healthcare providers like reproductive health. We felt like our role is really more of an assurance role. So we do have statutory requirements that we need to ensure that there is assurance of access to services, and that is something we do monitor. We've done surveys of individuals that we transitioned out of our care into their primary care providers to make sure that they were able to seek access. So we kind of have that oversight to make sure that capacity exists in our community and within our providers, and that people then have the opportunity to get into that front door and access those services. We didn't see the need for us to be an actual provider. We don't do primary care. This was in our public health division. Primarily, we're shifting away from a lot of that direct service and really more to, again, sort of system oversight, population health, and really very specific services such as the response to COVID-19 that are really sort of in our wheelhouse and our expertise. This was something that we determined was not a service that we needed to provide because it existed in our community, and so our role was really just to facilitate that transition and to make sure that assurance occurs. And because that assurance role is in statute for the local public health authority, that is something that we take very seriously. We fulfill that requirement, and we have other funds that can do that. We didn't need the PE 46 funds to cover that statutory responsibility. And so we had notified Oregon Health Authority that we were opting out of that, in part because it leaves us, there's an administrative burden. It requires additional financial reporting, auditing related to these funds of a role that we are already statutorily required to provide. And it also potentially allows additional restrictions to be and requirements to be placed through the contract that's over and above what's statutorily required. So that was kind of the approach that we took.
Okay. You look like you're gonna say something.
No, I was just gonna say that this movement away from direct provision of services is really part of a statutory scheme. I mean, it's really something the state is pushing as they expand the CCO and Medicaid and Medicare and all that. So really and then this audit that, review that was done as part of the public health plan, it wasn't just funds from PE 46 that were affected, it was the provision of direct care versus sending it to the CCO. So really, it's aligning our services with the overall state mandate.
Great. And I just have one more question because I'm curious. I know that you've said primary care provider several times, and I know that there's a fair amount of our population that actually doesn't have a primary care provider, and or maybe they don't have insurance for whatever reason. So is there an option within the health department? Can they contact the health department and state, I don't have a provider and I don't have insurance, and then you provide like the bridge of access and connection to those services in some way?
They can absolutely reach out to our public health clinic, and we will help facilitate, an entry point for them. So there are providers that will do, that will provide services to people without coverage. There are also the ability, so the same program that we were a part of, which was the reproductive health program through the state, other providers can register and become eligible to serve that same population that we were serving and have access to a different funding source that's over and above, like private insurance, those kinds of things. So we're also available to provide technical assistance to providers that might be interested in saying, oh, that's a population that we would like to expand and serve. How do I get registered through OHA to be able to provide that service? What does the billing and what does the funding look like? And we're there to assist in that as well.
Great. Thanks, Ryan.
Thank you.
Great.
All right, Mr. Chair, I move to approve amendment number 24 to the incoming funds intergovernmental agreement with the Oregon Health Authority to remove $41,909.29 for a new contract total of $18,807,588.92 to operate in contract for public health services through June 30th, 2021.
All right, I'll second that motion. Any further discussion?
No, it's a big number.
It's a big one to say. No further discussion. All those in favor signify by saying aye.
Aye.
Aye. Okay, Ryan, I think you're still up. Consider approval of incoming funds intergovernmental agreement with the Oregon Health Authority in the amount of $2,581,677 to operate in contract for Operation Public Health Services through June 30th, 2023.
All right, so now that we've just talked about sort of wrapping things up through our contract that expired on June 30th, 2021, this new agreement, this is the initial funding award for our public health services through Oregon Health Authority for the 21-23 biennium. The funding amount is actually only appropriated for the first fiscal year, so this $2,581,677 represents funding for our core public health services for fiscal year 21-22. And when I say core public health services, I'm talking about things that have been longstanding. So COVID aside, now we're talking about like immunizations, WIC, communicable disease, drinking water, monitoring, those types of services. And this is very much in line with historically what we've received for these specific services. I know it looks a lot different than the $18 million contract we just talked about, but again, that had a lot of one-time funds for COVID. I do anticipate that we will see some additional amendments to this to carry over any of the unspent COVID funds that we may have with our prior agreement. So many of those funds extend out for multiple years, but they were all awarded in fiscal year 2021, not knowing what level of funding that we would need, but wanted to make sure that all local public health authorities had adequate funds available to them. When we do as we wrap up that contract and we do our final financial reports, they'll know exactly how much funds may or may not be unspent, and they will then amend this contract and award those funds for us to carry those over. So I do anticipate that this number will increase, but this number is, specifically for kind of our base public health services that we've traditionally provided. And in terms of what we budgeted, it's almost exactly in line with what our budget estimates were in the adopted fiscal year 21-22 budget for these services. So that's good news. It's really in alignment with what we were anticipating. And so I don't know if there's any questions specifically about this.
No, you guys do so much over there.
They do.
So
They
much.
keep busy. That's
Yeah,
for
they
sure.
do.
Okay,
All right, Mr. Chair, I move to approve the incoming funds intergovernmental agreement, with the Oregon Health Authority in the amount of $2,581,677 to operate in contract for the operation of public health services through June 30th, 2023.
all right. We have I'll second the motion. We have a motion and a second. Any further discussion? Hearing none, all those in favor signify by saying aye.
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 Thank
Thanks,
you.
All right,
Ryan.
thanks, Ryan.
Thanks.
I feel like I haven't seen you. We're not hanging
You
out
know,
like
it's like-
by every couple of days.
We used to see him at least 3 times a week.
That is true.
Then it dropped to 2, now it's dropping maybe to 1, and every other week 2 or so.
Well,
Yeah.
that's usually a good sign.
Uh-huh.
Yeah, for sure, thanks.
Now we can get back on track of moving forward instead of reacting, right?
Yeah, hopefully.
Okay, our next item is under legal counsel. Consider approval of an order authorizing Marion County Council to negotiate with the entities that have already filed opioid litigation on behalf of Oregon local counties. Jane, welcome.
Thank you, Mr. Chair. Just a little bit of background. So prior to me joining the county, I think it was probably around 4 years ago, Marion County was asked whether it wanted to join a class action lawsuit with other local entities against pharmaceutical companies as part of the fight against the opioid epidemic. And the decision was made at that time not to join. And I think only 10 counties and cities actually filed this class action lawsuit on behalf of Oregon local entities. So now these lawsuits are starting to settle. They're part of this multi-district litigation. And the thought is that pretty soon a settlement will be reached with the litigating counties. And what the pharmaceutical companies have said is, we don't want to settle with you unless we know that we're not going to have any other lawsuits filed against us in Oregon. And so they said, if you can get 100% participation on your counties, we will consider sending the money to the counties on the local level. If you can't, then we're going to send it to the state, and you can fight it out with the state. And so the litigating counties have reached out to us, and I addressed this with the board, and the board indicated that they would be willing to cooperate with these counties. And so as part of that, this board order is something that I would submit to the litigating counties. They would show it to the opioid manufacturers, and I think they are pretty close to 100% participation in Oregon. And that way, any settlement funds would remain at a local level and local control. There would be bumpers around these funds. I mean, they would go to what they call high-impact opioid remediation, and so they would be used to fund or augment funding on programs that we actually already have, such as reentry, recovery, addiction support and services. It would also go to housing. The timing is, they think it's going to happen pretty quickly, so they'd like to get these board orders in so that we can all work. And the way that the actual, I think, process would work, it's still kind of a discussion, but the way that I think it looks at now is that non-litigating counties would actually work with the litigating counties and come up with a settlement. And the thought is that they would come up with a number of pills distributed per number of population. So the number would actually be quite high if we reach the settlement, and I think it would benefit our citizens. So if you enter this order, I would work with the litigating counties to reach a resolution, and I would keep you updated very regularly on any time I had any news to report on this.
Good?
Yeah.
Yeah, I think, we talked about this probably, was that at I'm trying to think, it was a BOC meeting or something where, this is probably about 3 weeks ago, so
Yes.
we're up to date on this. It makes sense to do it this way and not let the money go someplace else that we may not find it.
I think it needs to come here, so Portland doesn't get it all, is ultimately what I believe needs to happen.
Or the state, yeah.
Yeah, well, I think if it goes to the state, it goes to Portland.
All
Yeah,
right.
Great, thank you, Jean. Mr. Chair, I move to approve an order authorizing Marion County Council to negotiate with the entities that have already filed opioid litigation on behalf of Oregon local entities.
All right, I'll second the motion. We have a motion and a second. Any further discussion? Hearing none, all those in favor signify by saying aye.
Aye.
Aye. All right. Under Public Works, our next item, number 5, consider adopting administrative ordinance granting zone change ZC case number 21-002, J. Conser and Sons LLC. Ryan?
Good morning, Commissioners. So yeah, I have 2 items before you today. The first is a zone change. Both are similar in nature, actually, but the first is a zone change from commercial retail to commercial office on roughly a half-acre parcel located at 4080 State Street, just east of Lancaster Drive in Salem. The hearings officer conducted a public hearing on the application on May 13th and then issued an approval decision on the 1st of June, subject to conditions. Those conditions can be found in Exhibit B in our standard conditions of approval for developing a commercial zone property. The board received the decision and held it for the mandatory appeal period. No appeals were filed. The ordinance and findings have been prepared, and the notice of adoption was given on June 30th, 2021. The administrative ordinance is now set for formal adoption. The board has the option of adopting the ordinance as written, directing staff to prepare a modified ordinance, or choosing not to adopt the ordinance at this time. Staff recommend that you adopt the ordinance as written, and I'm available to answer any questions on this.
So are they changing this from like a shopping building to an office building? Are they just like remodeling the inside of the space?
So there's no current development that has been planned. There's nothing. Both properties in this case before you today, both are undeveloped.
Okay.
Actually, I think I think this one off State Street, there might be a single family home that is developed on that one. I take that back. There was an adjacent property that was did a similar zone change in January, and that one was vacant. This is right where to give you a reference point, where the yards food
Yeah.
carts are. Okay. So I think there's a single family home on this property.
That's right.
So both, that was commercial retail. Commercial office basically allows a little more flexibility in terms of residential development. It's supposed to be, the idea behind the zone is it serves as sort of a buffer between more high-intensity commercial uses and residential zones. And these 2 properties, the one in January that did the zone change, and this one, which is just adjacent, it sits right in between sort of the primary commercial strip on Lancaster and the residential area behind it.
Okay.
Yeah.
Thank you.
Okay.
All right, Mr. Chair, I move to adopt an administrative ordinance granting zone change ZC case number 21-002, J. Conser and Sons LLC.
I second the motion. Any further discussion? Hearing none, all those in favor signify by saying aye.
Aye.
Aye. Okay, consider adopting, item number 6, consider adopting an administrative ordinance zone change, granting zone change ZC case number 21-003, J. Conser and Sons LLC. And Ryan, you're still up, but I might have a question or two that you can't answer,
Okay.
all right? But go ahead.
Sure. So the second zone change is from commercial retail to commercial office on a 2.5 acre parcel located at 4712 Silverton Road, northeast in Salem. Again, the hearings officer conducted a public hearing for this application on May 13th, and then on June 1st issued a decision approving the zone change, subject to conditions. Those conditions also can be found in Exhibit B and our standard conditions of approval for developing commercial zone property. The board received the decision and held it for the mandatory appeal period. No appeals were filed. The ordinance and findings have been prepared, and the notice of adoption was given on June 30th, 2021. The administrative ordinance is now set for formal adoption. The board has the option of adopting the ordinance as written, directing staff to prepare a modified ordinance, or choosing not to adopt the ordinance at this time. Staff recommends that you adopt the ordinance as written, and I'm available to answer questions.
Well, what would we do if we said we wanted a modified ordinance? What would that look like?
That's a great question. I don't know if I have an answer for that. We could.
Could we ask Mr. Fenimore to come up and?
He acts like he's getting out of here early.
For the record, Joe Fenimore. You would need to look at the ordinance and see what exactly you wanted to change. And you could change findings, you could change the wording of the ordinance. You could add conditions if you wanted different conditions. So that is something you could do, I believe. Is that correct, Jane? Yeah. You would just give, you would give us.
What do you mean? With all those years of experience, you're looking at legal counsel to tell us what we can do and not
I
do?
always look at legal
When is
counsel.
your last day?
My last day will be August 31st,
Oh, well, you're probably gonna be before us again.
maybe.
I feel like he wants to sit in the audience and have all the new people
I'm
take care of
supposed to
it.
give the new planners face time.
I know.
They're doing a great job.
I totally understand that, but we're not gonna let you off that easy, right? We
Yeah,
want
there's
you to
like no
come.
beaver
And,
jacket or
I know,
anything. He's
and
like
no beaver tie, no
super
beaver
underdressed
jacket.
today.
That's what he was doing when he knew I was gonna
I
call him
know,
up, and
no
he's going,
tie.
I don't have my beaver gear on.
He doesn't have a tie on.
Yeah, yeah, that's okay. Well, hey, Joe, I know you're gonna be here for, well, another month and 3 weeks or whatever, but and I'll say this over and over again, your experience, your guidance to me as a commissioner since I've been here, probably the first week I was here and you came into my office and said, no, you can't do that. I remember I wanted to go look at a solar site, because in the legislature, I just went and looked at it and came back.
I remember that, yes.
You remember that day. I remember that day, and I go, who are these people telling me what I can't and can't do? And of course, Jane wasn't here yet, but I think you and Gloria might have been in my office, trying to keep me out of trouble.
Well, and then there was also the talking to applicants before the action item got to you. You couldn't-
Yeah, that's right.
Yeah, because everybody wants to call and talk.
Yeah,
to
I was
us.
driving down the freeway, I'll never forget this, and I can't remember how it came up, and I just called the representative of that company and said, hey, I want to come out and take a tour of this. And the next day, this is amazing, the next day, I didn't say anything. Somehow, they called.
Oh, they probably called their lawyer.
I think they called you probably.
I think that's what happened, yeah.
Yeah. And next thing I know, they're in my office saying, you made a phone call yesterday that you shouldn't make. What?
So I'm
I look-
curious.
So
Yeah, this is a hard,
it was a solar site, or it was a conversion of it was a conversion of a power substation to a solar site, I remember. And I wanted to go look at the neighborhood and see what the plan was. And so I called the person and was like, no, you can't do that, because it was something that was gonna come before us.
It had the
And
potential.
I couldn't have any more information than you
That's
could.
right, yeah.
If we all took the tour together, right, and announced it, then it's in the record, right?
Correct, yes.
So,
oh, I didn't know that. Good to know. I'm still new.
yes,
Super new.
yes, we have to be very, because that's when we put on our judicial hat.
Right. Yep.
And,
I do know that part because I think it's
So-
the scariest part of my job.
So
Don't mess up
anyways,
land use.
from that day forward, Joe and I had a real problem
Yeah, I'm sure.
holding me accountable.
But because of you, he visited me repeatedly when I first got here.
And trying to tell you.
I had several
Exactly.
phone calls and office visits, and he's done an amazing job getting me up to speed.
Ryan, you got some big shoes to fill, but we're really excited about the new group and you being a part of that, and the energy and creativity and the things you'll bring to the county, and whatever you can drain from this guy
Yeah.
before he
He has a
leaves.
camera in his office recording all the things
My
because it's
gosh.
necessary, I feel like. You should have recorded his introduction to me in my office around this table. And actually, I refused to sign a plat when I first got here. He laughs. I was like, I don't know what that is, and not a single person in this building could help me. I went to the assessor's office. Nope. They were like, I said, who do I call? Joe. Call Joe. So he came over and walked me through the whole thing.
The process.
The whole process, explained what it was. Those are important documents. I'm not signing history unless I know what it is.
Yeah, we are trying to drain him of all of his knowledge. He did make sure that I wore a tie today.
That's good
Yeah.
information to pass along.
It's interesting, because that's when I was in the legislature, I always wore a tie on the House floor. It was respect for the office, it wasn't about me. And then same here, I just wear a tie. And I used to wear a tie, like Sam wore a tie every day when he came to work. That was his uniform, he always told me. And I was wearing a tie, but now, since the fire, it's like, I'm lucky if I don't have shorts on right now. It's like, but I do still, I think you're bringing them up right, when you're coming to it's not about us, it is about respect for the institution and the position. So, Joe, thank you. I don't know when your party is, or if my schedule allows me to be there, or if you're even having one.
He's so having one.
Undecided.
It's undecided?
Oh, have
Well,
a party. I like parties.
Yeah.
Have a beaver cake. The last beaver, they made a duck cake for us there last week. Yeah, they have
Yeah.
to do better.
Thank you again for your service, and Ryan, thanks for your service too. Appreciate it, all right.
Yeah.
So, I think we need a motion still.
That's right. Mr. Chair, I move to adopt an administrative ordinance granting zone change ZC case number 21-003, J. Conser and Sons LLC.
I'm still wondering if I
Oh, I
want
was
to have
thinking, did
staff
that
come
wrong?
back with another recommendation. I'll second the motion. All those, any further discussion? Hearing none, all those in favor signify by saying aye.
Aye.
Aye. Okay.
Thanks,
you.
Joe. Thanks, Ryan.
Thanks, Joe. Thanks, Ryan. Ryan, we'll see you again, I'm sure, before Joe leaves. Hope.
Oh,
Right.
for sure.
Was this your first time in front of us? I know Lynn.
It is.
Yeah,
At least
Lindsay.
since I've been here.
Lindsay's been here once or twice, I think.
Alyssa's been here once.
Huh?
Alyssa was here once.
Alyssa was here once. Lindsay.
This is the first time.
All right. Well, you
Well,
did a good job.
How about I read the calendar while you
Why
sign
don't you do that?
papers? Okay. Today is July 7th, Wednesday, 9 a.m. We're in board session, location Senator Hearing Room, first floor, 555 Court Street, Northeast Salem. At 12 o'clock today, we're scheduled for a virtual meeting for the Woodburn Marion County joint meeting. And then on Friday, oh, we don't have anything tomorrow. That's weird together. On Friday the 9th, we have the Greeters Breakfast at 8:30 a.m. at the Marion County Fair, 2330 17th Street, Salem. I'm super excited for that. And then at 10 a.m. on Friday, Marion County Fair opening ceremony. It says it's at 10 a.m., but I think we're kicking off at 10:15 for folks that want to participate. Marion County Fair, 2330 17th Street. And then at 4:30 on Friday, 2020 CNEM Wildfires Heroes Recognition Program and Dinner. Location Marion County Fair, 2330 17th Street, Salem. And then on Monday the 12th at 10 a.m., Economic Development Coordinator interview. Brenda, can you make a note that the calendar has a typo? Commissioners Boardroom, 5th floor, 555 Court Street. And then at 11 a.m. on the 12th, Economic Development in Cities, Commissioners Boardroom, 5th floor, 555 Court Street, Northeast in Salem. And then at 1 p.m. on Monday the 12th, Board of Commissioners Chief Administrative Office meeting, executive session if needed pursuant to ORS 192.660, 2A, B, D, E, F, H, I. Location Commissioners Boardroom, 5th floor. On Tuesday the 13th at 7:30 a.m., Staten Marion County meeting at the Covered Bridge Cafe, 510 North 3rd Avenue in Staten. And then on Tuesday the 13th at 9:30, we have management update. Commissioners Boardroom, 5th floor, 555 Court Street. And then on Tuesday at 1 p.m., we have a work session, meeting with U.S. Army Corps of Engineers, Commissioners Boardroom, 5th floor, 555 Court Street. Are we gonna talk about the water? Is that what that's about?
Which one?
The Army Corps of Engineers meeting? I haven't seen any notice on that work session. I wanna know.
I think it is just an update for what they're working on.
Okay, great. We should notify folks up the canyon.
It's the 7th, isn't it?
Today is, sorry folks, the 13th, Tuesday at 3 p.m. work session, overview of justice reinvestment in Marion County. Location Commissioners Boardroom, 5th floor, 555 Court Street. Tuesday at 4 p.m. Marion County Public Safety Coordinating Council, Commissioners Boardroom, 5th floor, 555 Court Street. And then Wednesday at 9 a.m., we're back here for board session, Senate Hearing Room, 1st floor, 555 Court Street. Wednesday at 3 p.m., we have a Board of Commissioners Chief Administrative Office meeting executive session if needed pursuant to ORS 192.660 to ABDEFHI, location Commissioners Boardroom, 5th floor, 555 Court Street. And then, next Wednesday, the 14th, at 4 p.m., we have a FEMA briefing for local officials, Commissioners Boardroom, 5th floor, 555 Court Street. This just goes to show the public that we don't always know what's on our calendar until it shows up.
Well,
It's a week ahead. I'm trying to get through tomorrow.
Right. We always have a lot of add-ons too, like,
yeah,
Oh,
in
I
between.
know,
Oh, yeah,
especially since I've
changes.
been here.
not things that should be noted, but just what you individually do.
Oh.
Your workload is huge.
Oh my gosh, I know. It is huge. It's really great though. We have such a great opportunity to do good things.
Oh, it's really great when you get,
Oh, I'm tired
did you see
today.
all the great emails you got for your decision you made yesterday?
I did. Yesterday
Isn't
somebody
that
told me I was
fantastic?
spineless. I thought, you've
I
never
know.
met me. You can't say
Yeah,
that.
I know.
How rude. I dare, you should call me on the phone and let's have a conversation. That's what I prefer.
Yeah.
Send me an email.
People
telling me
make
I'm
judgments all
spineless.
the way. Oh, chair only, chair only. Oh, we'll pass you stuff you don't need to sign. This one you need to sign. Brenda's so good, I just don't pay attention to her directions.
It's okay, I do.
It's kind of like life with me.
All right.
Anything you want to say before we sign off?
Come to the fair. We didn't have a presentation, no rabbits
Yeah.
or anything today.
Friday night, 4:30, we're on, is it 4:30? We're
That's
honoring
right. But
all the
it's
first.
RSVP only, so it's not open. It's like there's, I guess they
For
can
the,
come
for the
watch.
ceremony, they can come
They can come
watch,
watch?
yeah.
Okay.
But the dinner is RSVP
That's
only.
right.
Yeah, but we're gonna be honoring, all the first responders, our deputies, fire departments that, participated in the wildfire back in September and, just doing a nice little presentation and saying, thank you, thank you, thank you, so.
I'm just excited for the fair. I just want to say to the public, have grace. We didn't know that COVID was going to be lifted for sure, and our volunteers and our fair team did a phenomenal job to be able to put on what's available to us right now, and next year will be bigger and better.
That's true, and then yesterday I had an emergency meeting with the Oregon State Fair Council that I chair, and we, at the beginning of the year, because our fiscal year's calendar year there, we had done 3 budget scenarios, but, A, full fare, B, modified fare, C, no fare for the year, and yesterday we said, we're moving to budget A, and we gave the director free rein to do as much as she can to get the fare up to a full fare, which, same thing, it's gonna be difficult to do this late.
Yeah.
And to manage expenses with, obviously with revenues, and it's gonna be interesting to see how it turns out. I assume we're gonna be pretty busy at the county fair, and that the state fair will be a real big hit this year, because people just wanna get out and celebrate that we're doing this. I did notice today, while we were sitting here, we got the text message from Ryan, we had 38 cases, which was up about 10 to 15 from where we were. We are gonna watch that, that's something that,
COVID cases, what you're talking about.
COVID cases, yeah. We are gonna watch that, and it'll be interesting. We opened the county or the state, and we had a 4th of July holiday where people were out and about, so we'll see how it goes. We just keep our fingers crossed and keep doing the vaccines. We talked about that yesterday with our weekly BIPOC community, and potentially door-to-door stuff that they're working on, and just got to get it out there, continue to go.
Yeah.
All right, anything else?
Nope.
All right, we will adjourn.